All right, so, you're at a music festival, right? Everyone's having a good time, music's blasting.
Hmm.
But, tucked away somewhere is the medical tent.
Right.
And you probably don't think much about it, but uh, what's kind of wild is how busy that medical tent gets is not exactly random.
Yeah, it's really interesting.
There's actually some factors that influence how often people need medical help at these big events.
Yeah, when you've got huge gatherings like that, the potential for somebody to need medical help, that goes way up.
Of course, yeah.
And so understanding those factors that play a role is really important to make sure everybody stays safe.
Yeah, absolutely. So that's what we're diving into today. We
Exactly.
got some research that really gets into those factors, specifically looking at music festivals in the Netherlands.
Yeah, that's right. Our focus today is on this study that was published in Pre-Hospital Emergency Care
Okay.
by G.D. Van Dyken and their team.
Got her.
And the title kind of gives you a good idea of what we're looking at. It's called Genre of Music Festivals as a Predictor for Medical Utilization Rate.
Okay, so that term, medical utilization rate, we're going to be talking about that a lot today.
Yeah.
MUR.
So you are.
And so, basically what that means is how many people at an event need some kind of medical attention.
Right.
And this study was looking at whether the type of music festival, like if it's an electronic dance music festival,
Right.
or what they call mainstream festival,
TBM versus mainstream, exactly.
if that has any impact on the MUR,
Yeah,
and then also if drug-related incidents play a role in that.
absolutely. That was a key part of the study,
Yeah.
looking at, was there a connection between the music and drug use and medical needs?
Okay, so that's what we're trying to figure out today.
Hmm.
Is there a link between the kind of music at a festival and how likely you are to need to go to that medical tent?
Exactly.
And are drugs a big part of that picture?
That's what we're going to find out.
All right, so let's jump into it. What did this study find?
Okay, so the main finding is pretty interesting. They looked at a lot of data.
Yeah.
20,829 patients
Wow.
across 518 events with nearly 7.5 million visitors.
That's a lot of people.
A lot of people.
Big data set.
It is a lot of data, and this was between February 2022 and August 2023.
Okay.
What they found was that EDMFs had a significantly higher average MUR compared to mainstream festivals.
Okay, so significantly higher. Can you give us some numbers on that?
Yeah, so the average MUR for EDMFs was 28.8 patients for every 1,000 attendees,
Okay.
compared to mainstream festivals, which had an average of 17.8 per 1,000.
Wow, it's almost double.
Almost double, and this difference was statistically significant, meaning it wasn't just a random chance.
Right, yeah.
It really does indicate a trend.
So EDM festivals, almost twice as many people
Yeah.
needing to visit that medical tent.
That's what it seems to suggest.
Interesting. Okay, and you said they look at a bunch of events?
Yeah, a lot of events.
So how many EDMFs did they look at?
They looked at 253 EDMFs and 265 mainstream events.
Okay, so pretty even spread.
Yeah, pretty good spread.
Any difference in the size of the events?
Yeah. Yeah. The median attendance for an EDMF was around 12,000 people,
Right.
compared to 10,000 for mainstream events.
Okay, so slightly bigger EDM festivals.
Yeah, slightly bigger.
On average.
Right. So right away you can see, okay, maybe there's something going on here with the type of festival.
Yeah, interesting. Okay, so let's dig into some of the specifics.
Yeah, let's get into the details.
What kind of medical situations were people experiencing?
Right. So they were looking at all kinds of medical needs, but they specifically focused on those requiring advanced medical care.
Okay, advanced medical care. So what does that mean? Like really serious stuff?
Yeah, the more serious stuff. So they defined advanced medical care, or AMS, as cases where patients couldn't sit up on their own.
Okay,
They might have unstable vital signs,
got it.
like really fluctuating blood pressure and things like that. Or they just needed more intensive medical help.
Okay, so the folks that are really in trouble.
Yeah, exactly. The ones that are in a bit more of a serious situation.
All right, so let's talk about drug use then. What did they find in those AMS cases?
Okay, this is where it gets really interesting. So in those AMS cases, the number that were drug-related was strikingly different between the two types of festivals.
Oh, wow. Okay, so give us the numbers.
So at EDMFs, 74% of advanced medical care patients were classified as drug-related,
Wow.
compared to 52% at mainstream events.
That's a huge difference.
It's a big difference, and again, this difference was statistically significant, so it really suggests a trend.
Yeah, so more than, 2/3 of the people that were really in trouble at EDM festivals,
Yeah,
drugs were involved.
it was to be the case.
Okay, so what kind of drugs are we talking about here?
So the study specified that stimulants like cocaine and MDMA
Okay.
were the main categories,
Got it.
and also what they called combined drug use.
Combined drug use.
meaning using at least two different categories of substances.
Okay, so like mixing stuff.
Exactly, mixing different types of drugs.
Okay, and that was especially common at the EDM festivals.
Especially at the EDM festivals, yeah.
So they were also looking at depressants and hallucinogens.
Yeah, they looked at depressants like alcohol and GHB and hallucinogens like LSD and magic mushrooms, but the stimulants and the multiple drug use, those were the most common ones, especially in those serious cases at the EDMFs.
Got it. And I guess some people, they didn't know what they took.
Right, exactly. So they had a category for suspected drug use,
Right.
where maybe the person was unconscious or unable to communicate,
Yeah.
and so they couldn't get a self-report.
Got it.
But-
Okay, so how did they decide then if a case was drug-related? Were they, like, testing everybody?
That's important to note. They didn't routinely do drug tests.
Okay.
So the classification was based on what the patient told them and the healthcare provider's suspicion if it seemed like intoxication was the primary reason for the medical issue.
Got it. Okay, so what about those non-drug-related AMS cases? Could drugs have still played a role in some way?
Absolutely. So you could have situations where somebody had used drugs but needed advanced care for something else.
Yeah.
So for example, you could imagine you're at a festival, you've had a few drinks, and you twist your ankle. You might need more serious treatment for that ankle injury, even though it wasn't directly caused by the alcohol.
Yeah.
Or somebody might have severe dehydration or heat stroke linked to stimulant use, where the primary medical problem isn't the direct effect of the drug, but it's a consequence of it.
Yeah. Makes sense.
Yeah.
Okay, so let's go back to the medical utilization rate itself.
Yeah.
You mentioned the averages earlier, but the study also talks about median MUR values.
Right.
Why is that important for us?
Yeah, so the reason they look at the median is because the data wasn't perfectly spread out.
Yeah.
Some festivals had really high MUR, some had lower ones.
Right.
The median gives you a better idea of that typical MUR you might expect.
Got it.
So for EDMFs, the median MUR was 24
Okay.
per 10,000 attendees,
Okay.
with an interquartile range or IQR of 15.7 to 39.3.
Okay.
For mainstream events, the median was 15 with an IQR of 7.3 to 25.9.
Okay, and just to remind me, what's IQR again?
Yeah, so the IQR, that's the range where you find the middle 50% of the data.
Okay.
So it gives you an idea of how much the MUR can vary.
Right.
Within each type of event.
Got it. So even when we look at that typical middle-of-the-road festival,
Yeah.
EDM still higher,
Go higher, yeah.
MUR.
And again, that difference was statistically significant.
Got it. Okay, so one thing that I thought was interesting was the hospital transport rate.
Oh, yeah.
What did the study find there?
So they found no significant difference in the rate at which people needed to be transported to a hospital.
Oh, really?
Between the two types of festivals, the median rate was 0 for both.
Wow.
Meaning that for most festivals, nobody needed an ambulance to go to the hospital.
That is surprising considering, all the stuff we just talked about.
Yeah, it is a bit surprising, you would think. With a higher MUR and more drug-related cases at EDMFs, you might see more hospital transports. But that wasn't the case.
How do they explain that?
So they suggested that one reason might be the presence of really well-trained on-site medical teams at EDMFs.
Okay.
Often including, doctors, paramedics, people
Yeah.
who are specialized in managing drug-related emergencies.
Right.
So they might be able to handle more severe cases right there at the festival, stabilize the patients, and allow them to recover without needing to go to the hospital.
That's fascinating.
Mhm.
So it seems like knowing that it's an EDM festival, they're really stepping up their game with the medical staff,
It seems that way.
which makes sense,
Yeah.
given what we know now.
Yeah.
Okay, so beyond the music genre itself and drug use, did they look at any other factors that could influence, how busy that medical tent gets?
Yeah. They looked at a bunch of other things. They wanted to see what else might be connected to the medical utilization rate.
Cool. Okay, like what?
So one thing they found was that the bigger the festival in terms of total attendees, the higher the MUR tended to be.
Okay, yeah, that makes sense. More people, more potential for problems.
Exactly. More people, more chances for somebody to get hurt or sick.
Right. Okay, what else?
Yeah. They also found that for outdoor summer events, higher maximum temperatures were associated with a higher MUR,
Okay.
while higher humidity was linked to a lower MUR. This is in the Netherlands.
Yeah.
They pointed out that, in the Dutch climate, the hotter days are often less humid, so those two things kind of go together.
Yeah, that makes sense.
Interestingly, they didn't find a significant difference between indoor and outdoor events overall.
Okay, so it's not just being outside, it's the heat.
Yeah, the heat seems to be a factor.
Got it.
What about when the events happen?
Yeah.
They found that events that ran both during the day and night had a higher MUR compared to just daytime or just nighttime events.
Makes sense. Longer you're there.
Longer you're there, more potential for things to happen.
Okay. What about the length of the festival?
Yeah, they found that festivals that were 3 days or longer had a higher MUR than shorter events.
Okay, so the marathon festival's more risk.
Yeah, it seems that way.
Got it.
And then another interesting one was camping.
Camping.
Yeah, festivals with camping facilities had a significantly higher MUR.
That's interesting.
Yeah, so maybe people are staying on site for longer. Maybe there's different patterns of behavior or substance use in a camping environment.
Yeah, I can see that.
Hard to say for sure, but it's definitely something to consider.
Right, if you're planning on camping at a festival. Right.
Mhm.
Anything else?
Yeah, two more things. They noted that younger patients and a higher proportion of tourists among the patients were associated with higher MURs.
Interesting.
And they suggested that, this might be linked to potentially higher drug use in these groups.
Yeah, I could see that.
But they acknowledged that they only had this data for the patients, not for all attendees.
Right.
So it's hard to say for sure.
Got it. Okay. So lots of interesting findings here. But we should remember that, like any research, this study has its limitations.
Absolutely. Every study has limitations, and it's important to keep those in mind when we're interpreting the results.
Right. So what are some of the limitations of this study?
Well, one thing they pointed out is that this study was done specifically in the Netherlands,
Right.
which has its own unique drug culture.
Of course. Yeah.
So, we can't be totally sure if these exact findings would apply to music festivals in other countries that might have different norms and different drug availability.
Yeah. Totally different scene in a different country.
Absolutely.
What other limitations did they mention?
Another thing they pointed out was that they used a fixed number of attendees for each festival based on ticket sales,
Right.
which doesn't take into account that the number of people on site can change throughout the event.
Right? People come and go,
Exactly.
especially at a multi-day festival.
Right. So that could affect, how accurate the MUR calculation is at different times.
Yeah, and I imagine it's pretty hard to get a perfect count of how many people are there every hour of the day.
Yeah, especially at these big events with tens of thousands of people.
Yeah, exactly.
Yeah.
What about the music genres themselves? I mean, how did they define those?
Yeah, that's a great point. So they acknowledge that it can be tricky to categorize festivals just by music genre.
Right.
Some are pretty clear, like hardcore or hardstyle.
Yeah.
But then the lines between techno house and more mainstream electronic music can be a bit blurry.
Sure.
And so that could introduce some subjectivity into how they classified the events.
Yeah, totally. So, all that being said, what are the big implications of this research? What can we actually do with this information?
Well, I think one of the most immediate implications is for better planning and allocation of medical resources at these festivals.
Okay, yeah.
The clear link between EDMFs and a higher MUR, largely due to drug-related incidents,
Right.
suggests that those events might need more medical staff and specifically people with expertise in handling drug-related emergencies.
Right, so just knowing it's an ED festival, you got to be extra prepared.
Exactly. It points to a more targeted approach to allocating those resources.
Okay, yeah, that makes sense. And I imagine this data could also be helpful in, developing some kind of prediction model.
Yeah, absolutely. They suggested that we could develop models that take into account not just the music genre, but also things like attendee characteristics, features of the festival, like how long it is there camping, and even the weather.
Right.
And these models could help predict how many resources they might need
Right.
and potentially anticipate when there might be a higher risk of drug-related issues.
Yeah, that's amazing.
Yeah.
I mean, if they could actually start to predict that and be prepared, that would be incredible.
Yeah, it could be a really valuable tool for the organizers and the medical teams.
Yeah, okay, so a big takeaway here is that there seems to be a strong connection between electronic dance music and a higher need for medical services at festivals.
Yeah, that's a good summary.
And drug-related incidents are a big reason for that.
Exactly. It seems like the genre of music is an important factor to consider.
Yeah, for sure. All right, so zooming out a little bit, what does all this mean for other kinds of big events, not just music festivals?
That's a great question. It really makes you think about how these findings might apply to other types of gatherings like sporting events, political rallies, any large group of people.
Yeah, I mean, could this help us understand how to better plan for medical needs at any event?
Potentially. If we can understand how things like the type of event, the demographics of the attendees, even the weather, can influence medical needs that can help us plan more effectively.
Yeah, and maybe come up with better harm reduction strategies too.
Absolutely. By understanding what factors are associated with higher risk, we can tailor our harm reduction efforts to the specific event and the people who are going to be there.
Yeah, that makes a lot of sense. Okay, well, this has been a really fascinating deep dive into some pretty important research.
It's really interesting stuff, and it has a lot of implications.
Yeah, for sure. And if anybody wants to learn more, we'll put a link to the original study in the show notes.
Yeah, definitely check it out.
All right, thanks for joining us for this deep dive. We'll catch you next time.
Thanks for having me.